New at 6, the pandemic threw a curveball to expectant mothers, adding a barrier for some in finding health care. As Mary Jo Ola reports, a local hospital found a way to help.
Hello.
3-month-old Nigeria Melendez is one of the cutest and calmest babies you'll meet. Her mom, Nairi, remembers finding out she was pregnant on Father's Day.
I was too emotional, really, but I was surprised at the same time.
It was also at the height of the pandemic.
But most times I was scared to come to the hospital because of COVID.
Soon after, Nairi connected with the maternal health team at Ascension St. Joseph Hospital in Milwaukee. They recently started doing home visits for those who face barriers to getting to their appointments.
One was childcare, and another huge barrier was transportation.
Shar Crawford is a community health worker and a huge part of what makes this outreach successful. She does home visits herself with a midwife to ensure every mother has what she needs.
Afterwards, after we started going to the patients' homes, doing the blood pressure checks and the belly checks and things like that, maybe after 2 times, guess what we found out? They would come in. They would come in because they have found a comfort point somewhere.
To further help mothers, St. Joe's started offering a special waiting room for kids as well as coordinating rides.
I really appreciate it because, like I said before, I really didn't have nothing or nobody. It was just me lost with a baby, basically.
Allie McNeil with Ascension says the team has reached hundreds of women.
Every mom that Shar and her partner have touched in their life have had better outcomes because of it.
And since the work began, they're seeing babies are born healthier and moms are doing better.
We're living the mission of our organization by doing this work. You know, it's really meant to help serve the most poor and the most vulnerable out there, and that's what we get to do every day.
It's time consuming, and I just love it because why not? This is our community. If we don't do it, who will?
Leaders at Ascension say this program has been so impactful that they're looking at replicating it across the country. In Milwaukee, Mary Jo Ola, TMJ4 News.
And leaders at Ascension say adequate prenatal care is considered 7 prenatal visits starting in the first trimester, but ideally it's more like 11 to 13 visits. They add that engaging with mothers early on and being alongside them throughout the pregnancy leads to better birth outcomes.